Welcome back to our video series on robotic pet therapy. I'm Lauren Bade, and I'm part of the research team here at the University of Utah that has been examining the feasibility and efficacy of robotic pet interventions for older adults. In this video, I'll give you an overview of what robotic pet therapy is, discuss who can benefit from it, and address some common misconceptions. Let's get started. I bet you might be wondering what robotic pet therapy is. Well, robotic pets have been used increasingly as a therapeutic intervention for a wide variety of clinical populations over the last 20 years. Research has linked interaction with robotic pets with a variety of outcomes. Our research was focused on mood and engagement in older adults. We found that participating in robotic pet therapy groups significantly improved residents' mood. We also observed high levels of engagement amongst clients during the sessions. Robotic pet interventions can be delivered one-on-one or in a small group setting. In our research, we established groups of 4 residents and allowed each resident to have their own pet and allowed them time for each individual to share their stories. In our research, robotic pets weren't meant to replace real pets. Instead, they offered some unique traits and abilities that real pets don't. For example, a robotic pet doesn't need food, water, breaks, or trips to the veterinarian. Robotic pets also have a reduced risk for infection control issues when compared with real animals, which is really helpful in hospital and long-term care settings. You may have also heard that robotic pets are only beneficial for clients with dementia, but robotic pet interventions can actually benefit all clients regardless of cognitive ability. In our research, we divided clients into groups based on their cognitive level or their brief interview for mental status score, or their BIMS score. The groups were organized as follows: the cognitively intact group, or a BIMS score of 13 to 15, the moderately impaired group, or the BIMS score of 8 to 12, and the significantly impaired group, or a BIMS score of 0 to 7. We found that clients in all of the groups experienced statistically significant improvements to their mood from the start of the sessions to the end. All of the clients also experienced high levels of engagement during the group. I'm a recreational therapist, and I use robotic pets to facilitate groups that encourage social connection and reminiscing, as well as positive sensory experiences for my clients. There are some ethical considerations people occasionally think of when they find out about robotic pets and their use as a therapeutic tool. Robotic pets can be an empowering tool when presented in a way that preserves the client's autonomy. Clients should always have the choice of whether or not they want to interact with a robotic pet. Additionally, the facilitator should never try to convince a client that a robotic pet is real. We've found that many clients thoroughly enjoy connecting with a robotic pet, even when they recognize that it's a robot. We've even had discussions on how to change their batteries together. That being said, clients with more significant cognitive impairment may or may not know that their pet is a robot. This is where validation of their current reality is key. Meeting a client where they're at is compassionate and is considered the best current practice on the care of individuals with dementia. Some facilitators occasionally worry that bringing robotic pets onto a unit or into a group may bring up painful memories of lost pets or pets that clients had to give up when they moved into a long-term care setting. Interacting with robotic pets does tend to elicit a ton of reminiscing amongst clients, most of which centers around fun stories and joyful moments. Regardless of the content, we've found that all of these memories tend to invoke a sense of connection. Our research joins a growing body of evidence supporting robotic pet therapy as an innovative and effective therapeutic intervention. The results clearly demonstrate that these interventions can benefit older adults across all cognitive levels, promoting positive mood states, social engagement, and meaningful interactions. As healthcare continues to evolve, robotic pet therapy represents an exciting intersection of technology and therapeutic recreation that can enhance the quality of life for many individuals. This video is part of a series. For more information on our research on robotic pets, please check out the rest of our videos.